Good morning everyone, it's Michael from Skills to Move Physio. Today we're talking about shin splints as requested on the Facebook page by Michael McManus. So shin splints, what are they? Why do we get them? And what treatment can we do for them? So first of all, what is it? It's pain at the front of your lower leg. It usually comes on during and definitely after exercise. And it's more due to an overuse injury than a sudden injury. It usually comes on if you've just started doing some interval training or you've just increased your activity. That's when you can get the shin splint pain. When we're talking about shin splints, there's three structures that we're looking at. We're looking at the muscles, we're looking at the bones, and we're looking at the tendons. Specifically, we're looking at the tibia, which is the big bone in your lower leg, and we're looking at the periosteum, which is the covering on the bone, where all of the muscles and everything attach onto there, and it can pull. So why do we get it? Well, there's huge aspects about why people get it. The main reason, though, is due to a sudden increase in activity without working up to it. It can be the angles from your hip to your knee to your ankle, and your foot mechanics that can put added stress on the muscles in your lower leg. The foot mobility, if your feet are not moving enough or if they're restricted, then you need to get that movement from somewhere, and that typically comes from other areas, and that can stress the bone. And we also look at muscle strength and endurance. So the strength, if they're strong enough to move your body weight, and the endurance, if they're strong enough to go for extended periods of time. So the mechanism of injury is usually overuse. So people, yes, it's a summer health kick, let's get out and run, and they get pain in the front of their leg. It usually happens when you're running on a hard surface. So if you're getting shin pain, you need to start on softer surfaces like grass and work your way up to the harder surfaces. So what can physio do for shin splints? Well, we obviously give you advice, and usually it consists of slowing the progression of your exercise. So you're not going from nothing to 5Ks a day. We're wanting to just slowly increase that exercise so that your muscles get used to it and the muscles can adapt. So we assess your muscle power and your muscle strength. One of the big things that I like to look at is the proprioception, so your muscles and joints' ability to work together to maintain your balance and reduce those injuries. And we also look at possibly some taping and some compression bandages or skins to use around the leg so that it takes the pressure off that bone at the front. As always, we can use dry needling, we use muscle techniques, and we can even use some ultrasound if it's a pretty fresh issue for you. That can help as well. So I know it's been quick, I know it's been short, but there's plenty of things we can do to help with shin splints. I hope that's helped. As always, follow us on Facebook, look at us on Instagram. It'd be great to see you in the clinic. Thanks a lot. Bye.